Welcome to the Fix Affairs at Home. Thank you for joining us. My name is Wing. I'm one of the coordinators of the Fix Affairs, which are City of Portland, Oregon community resource events. And with that, I want to welcome our friends from the Office of Community and Civic Life, Stacy and Mary. Thank you so much for joining us today. Take it away.
Good morning, everyone. It's a pleasure to be here today. Today, we're going to have a presentation about social isolation. From social isolation to social connections, taking care of yourself and your neighbors. My name is Stacy Vu, and I'm a community safety coordinator in East Portland with the City of Portland Office of Community and Civic Life Community Safety Program. And I've been with the program for about 3.5 years. I'll let Mary introduce herself before I provide a short description of our program services.
Thank you, everybody, for being here. My name is Mary Tompkins. I'm the Community Safety Coordinator out in East Portland for the Office of Community and Civic Life in the Community Safety Program. And I've been working with the Community Safety Program now going on 15 years.
Thank you, Mary. We have 3 geographical teams, Central, North, and East. Mary and I work on the East team with another colleague, Steve Witcherly. And we provide training and education. Our Neighbors Together trainings support communities to meet your neighbors, build connections, and collaborate to create safety solutions. And trainings can be tailored for your group's specific needs. So if you just want to talk to us, we're actually fun to talk to and connect you with appropriate services and resources. We provide a variety of trainings that include personal safety workshops, prevention topics, public safety resources, pedestrian safety, implicit bias, emergency preparedness, and also how to work with youth to address safety. Another popular service that we have is called the Crime Prevention Through Environmental Design, and it's our safety and security assessment. We use a multidisciplinary approach that relies upon a set of strategies to reduce unsafe behaviors. And some examples are looking at lighting, access control, gathering areas, structure, and landscaping. Before we get started, I wanted to go over some acknowledgements. So by default, we're all more isolated than we were before COVID-19. We probably all have experienced at some point, and especially during the last 9 months. And we all have different life experience of isolation and how it affects us. And we want to honor that in this training. So you may be attending this training because you're feeling isolated, and this is a good way to break that isolation. We also want to recognize that it's an incredibly difficult time right now. There's a lot of fear, unknowns, and people also may be experiencing various levels of trauma. So we want to let you know that there is hope. And as trainers, we're not mental health professionals, but we will be talking about how to connect you with mental health resources. And some of our training has been informed by our Bureau's mental health specialists. And we value diverse perspectives where everyone has meaningful access to services and resources. Even though we are the trainers, we appreciate your suggestions and inputs because we learn valuable information from you as the community members. So today, some of our training goals to understand social isolation is to define and understand what it means and how social isolation impacts our most vulnerable communities. So seniors, people with disabilities, people who are immunocompromised, people in recovery from substance abuse disorders, and people with limited English proficiency. And we want to help participants increase their awareness of social isolation, loneliness, and the services and resources that are available. Help participants build community connections with each other, understand more about community safety and emergency preparedness. And our key takeaways today is what can you do starting today to empower neighbors to address issues in their community. Social isolation is defined as a lack of contact with others, where people experience a lack of companionship and support. So human beings are social creatures, and our connections to others enables us to survive and thrive. Many of us, as we age, are alone more often than when we were younger, and due to other life situations, this can leave us vulnerable to social isolation and loneliness. Research has linked social isolation and loneliness to higher risks for a variety of physical and mental conditions. So high blood pressure, heart disease, obesity, a weakened immune system, anxiety, depression, cognitive decline, Alzheimer's disease, and even death. Fortunately, there are ways to counteract these negative effects. People who engage in meaningful, productive activities with others, they tend to live longer, boost their mood, and have a sense of purpose. These activities seem to help people maintain their well-being and may improve cognitive function. So we have a question for the audience. How are you staying connected with your community right now? Please put this in the chat. Social isolation can affect all of us, so age does not matter. And it is essential to take care of yourself so that you can take care of others. Everyone's physical and mental well-being is important. And for me, I find myself doing more meditation. That's a way to calm me down. There's lots of videos on YouTube that range from a few minutes to 30 minutes. I even bought meditation cards for my children because they're also doing online classes, which is really frustrating, especially for elementary children. My youngest tends to get frustrated easily, and to start off our day and to get grounded, we practice deep breathing. And she really likes this mountain pose that we do, where we're able to talk about what's frustrating us. And then she's able to blow all of her frustrations and it goes down the mountain. So there's lots of ways to take care of yourself. You can do the deep breathing, set the menu and determine what you want to watch and what you don't want to watch. Treat yourself. Perhaps you want to take a bath or go get a milkshake. I love food, so that's also another something else that I do for self-care. Social media detox, socialize, exercising possibly, hydrate, getting some rest, and embracing the light. Right now, there's not a lot of sunshine, but we've been getting, a good amount. And also doing just anything, again, that makes you happy. So we also want to know from everyone, what are some activities that you engage to combat your own social isolation and take care of your well-being, whether this is during COVID-19 crisis or just in general. Thank you for putting that in the chat. Another important piece is taking care of yourself, but also during this time, taking care and caring for others. So caring for others is a voluntary choice of yours. It is important to decide what you're comfortable doing and then commit to it. So I'm wondering if anybody has, do you have a neighbor whom you think may be isolated and vulnerable, that maybe you want to check in on, that's an older adult, has a chronic health condition, who's immunocompromised, has a disability, doesn't speak English? And then do you have their number that you can call, text, or video chat? Or possibly maybe it's somebody that you don't know in the neighborhood that you've noticed that maybe they're experiencing social isolation. Can you drop off a note or talk to them through a window or door? So some ways to connect is connect through social media. Some people are using Nextdoor, Facebook groups, social media, Zoom, and even church phone trees to identify vulnerable neighbors. And you can host a virtual training for your neighborhood with our community safety program. Again, we can cater different trainings for your needs. And recognize the digital divide. Most of the country right now, we're in lockdown. People are relying on the internet for important information, work, health, education, entertainment. But also recognize that many people don't have access to the internet, especially people who are experiencing poverty and have limited financial resources. Others may lack the skills to use technology. And there are ways that you can help. So if you know of connect people with free or low-cost internet services, perhaps you have an extra laptop, tablet, or other device that you can let someone borrow. Or offer to train someone on how to use technology or video conferencing programs. And lastly, pay attention. There's ways to be observant. Is their grass overgrown? Have you seen cars that have not been moved for a while? Are there mail or packages that are not picked up? And just ask. Don't be afraid of rejections. Worst case, you might feel bad, but the best case is that you're able to help someone. Next, we have a video that we'd like to share how people in our community are helping older neighbors and those with disabilities during COVID-19.
And there's many simple things that you can do to really contribute back to the community. One is obviously volunteering. Beyond that, you also have neighbors. You also have relatives. And being able to be intentional about reaching out and connecting with your neighbors is really important. Our goal is not just to deliver groceries, but also to help people age in place and to empower people to stay connected to the community.
All their groceries are not just in the bins, but they're in paper sacks, and we deliver the bins to our clients' houses. And set them by the door, and we step back 6 feet.
There are some online networks like Nextdoor, but there's also the Nextdoor porch that you can knock on the door, step back so you have a safe distance, and check in on the seniors next to you. So there's lots of ways that you can actually help from your community. So if you can connect with others proactively, maybe if they truly have a need, you can then be the support to connect them with other resources in the community.
So I just wanted to point out something from the video. In this video, people are not wearing masks, but since there is an increase in coronavirus cases, we encourage people to wear masks and social distance if you have someone you want to reach out to. And this is only one example. We work in East Portland, and we have heard so many great stories of neighbors helping each other. We worked with an affordable housing complex that has 60 units. Many of the residents were facing food insecurity, and there was a neighbor who was able to solicit local farms and agencies dropped off canned foods and fresh produce for them. And she also was able to help people fill out paperwork who don't have access to a computer or have limited English. So applications for food stamps, unemployment. And then when she goes to the grocery store, she asks her neighbors if they need something, and she's able to pick up some medicine and foods for people that have barriers. So there's really a lot of things that you can do right now to help others. So we have up here, take the social isolation assessment. If you are concerned about yourself or others, the American Association of Retired Persons provides a self-assessment to find out if you are at risk. So this is one of the resources that are available. Next, I'm going to turn it over to Mary to talk about our Neighbors Together program.
Okay, thank you, Stacy. So like Stacy was saying, bringing this together is basically what social isolation and what all this presentation is all about. And I'll share something I just did recently. And I have a really good friend who works for self-enhancement and at high risk in terms of trying to get out into the community. And so the other day, I took her some lunch, went over to visit her, spent 3 hours over there helping her clean her house and making sure she's getting something to eat, making sure she has plenty of water, and picked up some medications for her. And then afterwards, she just sent me a quick little note saying that was the best thing that somebody had ever did for her, because she is so isolated. She's isolated from her grandchildren. Her granddaughters are in another state, and she hasn't been able to even see or have connections with her daughter. So bringing neighbors together is one of our primary goals and one of our bigger programs that we work the community and throughout Portland and all around the city, and basically just helping community members build connections with each other so that there's resources to help combat social isolation. We offer the trainings in Multnomah County, and these trainings can focus on increasing community preparedness and resiliency. We also have worked on very, very good partnerships with different bureaus. We work with Portland Bureau of Education, working with PPOT. We work with Safe Routes to School, just helping young people be able to take safe routes to school. We now have a partnership with ODOT, Oregon Department of Transportation, where we're doing pedestrian training with different home forward properties and different neighborhoods. We work with Solve, and that's a pickup nonprofit that we work with, and we're able to organize litter pickup, pedestrian training, and safe routes to school. And also we've been working with Ron Russell Middle School, and we created a youth safety curriculum, and we work with the middle school students on being safe as well. These are just some safety tips and just emergencies and personal safety. We have 2 colleagues on our team that do a great job of teaching personal safety. I'll just go over just real quickly what to do in an emergency. When to call 911 and interpretation service is when if your life is if you're in a life or death situation and a gun, a knife, they're breaking into your home, or you see or witness someone being attacked or shot or anything dangerous or life-threatening, call 911. They also have interpretation services for you if you speak a different language. Also, you can text 911. For example, if you're taking public transportation, you're in a house and you're hiding and you can't use your phone, you can just simply text 911. People think when they call 911 that they're calling the police station. You're not. You're calling the Bureau of Emergency Communication, and those folks are the one who will dispatch the police. Reporting hate and bias incidents. We do have a partnership with the Portland Against Crime and Hate, PUA, Portland United Against Hate. That's where you can report hate and bias incidents. We've had increase in hate and bias incidents throughout the pandemic and with the coronavirus. And so there's been a lot of minority communities that have been targeted with graffiti and racist incidents and name calling. And so with reporting that to PUA would be the best route to go. Our personal safety class, we have the 3-step model of assertiveness. And that 3-step model is being assertive 1, frame it, and change it. And also looking at passive and passive aggressive. Also addressing concerns about physical distancing and protocols. And I will put that on the next slide around COVID-19. I'm sure we've all seen this, just some safety tips to prevent the spread of COVID-19. We've kind of updated it a little bit. And one of that is wearing 2 face masks now, when doubling up when you go out. Of course, wash your hands for at least 20 seconds. And then regular things, don't touch your face, cover your coughs and sneezes, maintain 6 feet of distance from people you do not live with. keeping all surfaces in your home disinfected, trying to limit trips and stay close to home. And then again, the vaccination is out and about, and some people are getting vaccinated and some people are feeling still not comfortable with getting a vaccination, especially communities of color and specifically African-American communities, due to just the distrust of government and being used in experiments back in the past. So there's a lot of folks that are still not comfortable with getting the vaccination. And so hopefully as we move forward, there will be more information around the vaccination and pros and cons of getting one. Again, pre-COVID, there were special hours for high-risk individuals at grocery stores in the Portland metro area. And this was mainly due to the fact that everybody was in a big panic and they were going out and buying up all the supplies of the toilet paper and the disinfectant. And so we found this and gleaned this off of the Hollywood Senior Center's website. And these are just times that certain individuals can go to when they want to go shopping. And these are the times that are early in the morning and the different days. And these are actually still in effect, although we don't have the rush and the crowds in the grocery stores anymore that discourage, senior folks and people with vulnerabilities from shopping. But we had put this out earlier, 6 or 7 months ago, just to give people an opportunity to go shopping at the stores without the big crowd and the rush. Resources that we know about that are out there for you and others. Some of these resources, again, are probably resources that you all know about, but we just want to put these back out there just so people know that they're there. And I'll just go briefly through this really quick and not take up too much time. But of course, the Oregon Food Bank is still open and they have delivered so much food. So we always encourage people, if they want to donate money or do something, it's always easy to just go to one of these websites and donate money for some of these services, these nonprofits. The Sunshine Division, there's one out in East Portland as well as one out in North Portland. You can go to their website and just click request a food box. There's SNAP benefits for those that are low income. There's the Portland Food Pantries Market. I think this one is over in North Portland. Meals for Kids. Resources for older adults. The Adult Protective Services is the abuse reporting line. Of course, the Hollywood Senior Center. I mean, they're still open, but they are doing things with senior folks, still being able to engage them and going out for walks, art and crafts, and keeping folks busy so they're not so isolated. Helping Hands for Seniors, Aging and Disability, Store to Door. And Meals on Wheels for people and for children is a big one that could use donations and charity and volunteerism. And then the AARP Social Connections and the TriMet Lift Grocery Pickup Service. All of these services are still relevant in today's pandemic that we're dealing with. Additional services, of course, we still have 211. And Stacy and I did do some updating on our City of Portland eviction moratorium. And right now, the latest date since the new presidential administration came into office, it's been extended until June 30th of 2021, which is really good for folks in Multnomah County and around the country. But we're hoping that we will be able to support and help folks so that they don't lose their housing. Mental health resources. During COVID-19, a lot of people, we've been getting calls around mental health support with people being socially isolated. If they have mental illness, that mental illness has been just kind of aggravated and irritated, and more folks are showing mental health issues with social isolation. a lot of people are still just very, very lonely and just don't know how to cope with it. And so we came up with this Safe and Strong helpline so people can call people and just talk. We have a senior loneliness line, local trauma-informed care resources, and also Dave Rumphrey Organ Warm line. And these are peer-run counseling solutions, and if you call these numbers, people will respond and talk with you. We have the Suicide Lifeline as well, Military Helpline for Veterans, Youth Line, Alcohol and Drug Helpline, and also Disaster Distress Helpline. And just to let you know, in terms of our Neighbors Together training, we also work with Portland Bureau of Emergency Disaster Preparedness. And so we are able to go out and help do trainings around being prepared for a disaster. That's one of our partnerships. It's with PBEM. What can you do today, like Stacy talked about, when you're reaching out to your neighbors and you want to help or you want to volunteer? And I looked at the chat and saw that some of you someone mentioned that they're hosting a backyard dinner with their neighbors. How exciting. Those are the things that we're talking about when it comes to bringing neighbors together and looking out for one another, hosting barbecues or little dinners in your backyard, phone calls, group walks are really, really good. I personally, what I do is I have a small dog and we get out and we walk down to the Vancouver waterfront. Even though it's cold outside and kind of rainy, I still have been doing that, and that's been helping a lot with my mental health and keeping me focused. But I've also noticed on Facebook, there's different groups of people that are meeting around the city just to get people out so that they can walk. You can start your own walking group, and it can be a ladies walking group, it can be a neighbors walking group, it can be with the children, it can be bring your dog, bring kids in a little buggy, however you want to organize around your neighborhood and your community, all of it is positive. So who are the 3 people you need to contact for your well-being and to ask for help? Again, just thinking about neighbors, thinking about the elderly, thinking about people that are immune compromised and that can't get out. Me, I asked my girlfriend, what did she need? And she told me, and I went and I just did that. And I plan on doing that twice a month. I can come over, I'm gonna go over to her house, make sure she has groceries, just make sure that she's, you know, staying safe and has water and things to eat. Who are the 3 people you will contact after this training to check in on and offer help? So you, again, just thinking about people that you know, or people like Stacy said, people that you don't know, maybe someone in your neighborhood who you haven't seen for a while, and maybe someone whose mail is being picked up, or you know they live alone. Those are the folks that we're talking about doing outreach to. And then who are the 3 people you will tell about this training? Again, reaching out to those people in your circle, your neighborhood, on your block, and letting them know about social isolation and organizing with us to do a Neighbors Together training to get people connected to services, out walking and hosting barbecues and dinners in their backyard. This social isolation, this was a new training that we came up with, and it was just right after the pandemic that we did the research on this. But again, social isolation is just basically getting out of your house, getting out of your comfort zone, and being creative and starting to do things differently and look at the world a little different. Because it's looking like we're going to be still on lockdown for at least another 6 months to a year. One of the things I just want to highlight, and this is the last slide of our presentation, it's Black History Month. I just wanted to put this out there. We have one of our co-workers and city employee, Taisha McCauley Riley. She's going to be speaking in one of these council sessions. And Taisha works for Civic Life again, and she was one of the one of the co-workers that brought a lot of our mental health information and resources to this training. And so I just wanted to highlight something positive, that if people wanted to go online and reduce social isolation, this is actually happening today, February 3rd, between 2 and 3 p.m. You can also hear Dr. Markeisha Smith with the Bureau of Diversity and Human Resources. Go out, you can hear what she has to talk about as well. So I just wanted to share all this, and this is stay tuned for additional Black History Month events. There'll be other events, but I just wanted to highlight this for today since we were doing the presentation today. Thank you all for your participation, for putting questions and putting things in the chat for us. And we really appreciate having you guys here today and listening to our presentation.
Thank you very much, everyone, for your time.
Mary and Stacy, this is Wing with the Fix It Fair. Thank you so much. That is such a great presentation. We do have a couple of questions, so I will go ahead and read the first one out loud.
Okay.
Advice on how to stay COVID safe in a walking group. Masks, but what about distance?
I would just suggest one of the walking groups that I've been walking with, but I walk by myself, but one of the walking groups that I know that's walking, they're all maintaining 6 feet when they walk as much as possible, and they are definitely wearing masks. So my recommendations would be in walking groups, maintain 6 feet of distance and wear a mask.
And again, what Mary mentioned earlier, like maybe doubling up on your masks might be a good idea too.
And then again, and since you're outside, it's, you know, with the air and everything, we still just need to at least, you know, wear a mask or double mask.
Great, thank you. And there's a question that I can answer. Will the slideshow be available to share? Yes, this is being recorded. It'll both immediately be available on Facebook through the live option, and then Fix It Fair has a YouTube library channel that we have slightly edited library of all these resources available. And if you visit our website, which I put a link in the Zoom, and we'll put one in the Facebook comments as well, that takes you to all of our resources. And then we have another question. You mentioned youth are also having a hard time. Do you have ideas for kids to stay connected with each other safely?
I think one of the things that we talked about was self-care. Sometimes when we're thinking about children or youth, we don't think of them as having stress. They're also having a hard time dealing with the pandemic. So I think self-care is important. And other ways where people can connect is maybe through the fence or in the backyard or something like that, with distance, or possibly if there's a parking lot. There's a lot of apartments that we work with where people are able to social distance but still connect to other children there. And then also this is a really good time for, I think, parents to spend more time with their children since we are at home. And bringing back other ways like board games or having some kind of family night, a movie night, are also good ideas.
And I'll just piggyback off of Stacy with that as well. And I've been noticing and seeing a lot of parents have been setting up garages and empty space around the house and turning those into little art studios and little play areas. And so depending on the child and whether they're school-age children or a little older children, setting up space in the garage or in an upstairs room or a bedroom or something where it's just designated as a play area for them, and then putting out paints and arts and crafts and crayons and coloring books and stuff and things for them to do and read. I do know that a lot of pets have been adopted during this time, dogs and cats. It's a good time to train your child how to be more responsible for their pet, For example, making them responsible for getting up and feeding the pet, walking the pet, feeding the pet, and those things. I do know that a lot of my friends that have small children and pets, that's one of the things that they have been doing is assigning pet duties to the child, and the child is going out walking the dog now, and just being more pet friendly and engaged with the pets, also as well as being more creative, doing more painting, arts, crafts, and also parents are starting to read more to the child and making sure that the children are getting, their ABCs and numbers and stuff during the pandemic.
And what I hear from my kids all the time is we're bored. So there's a lot of stuff that you can do that doesn't cost a lot of money, and it still keeps them occupied, and try to stay positive. We when I talk to my kids and my colleagues, when I'm hearing stories, that it's a difficult time right now. And we want to uplift the children and the youth and make sure they're okay and kind of process all of this that's happening.